cases of COVID-19 and nearly 225,000 reported lives lost in Africa due to the pandemic. Africa is now officially in the fourth wave of the pandemic, which is partly due to the Omicron variant. There's been an 83% surge in new cases on the continent this week compared to the previous week. This is the fastest surge recorded since May last year. We are cautiously optimistic, though, as we are seeing fewer deaths during the early weeks of this current wave when compared to previous surges. Just over 3,000 deaths have been reported during the first 3 weeks of the fourth wave, and that's about half the number reported in the same period during the third wave. Additionally, evidence from South Africa is that while hospitalizations have increased by almost 70% in the past 7 days, intensive care unit bed occupancy rates remain low at 7.5%. Just 14% of hospitalized patients are reported to have needed supplemental oxygen, and deaths have remained low, with only 11 reported yesterday for the previous 24 hours. So mild illness mainly linked to the Omicron variant. However, with the number of new cases hitting record highs as rates double every 5 days, we can't afford to drop our guard. We're entering the year-end holiday season of traditional gatherings and travel, with vaccine coverage still disappointingly low in Africa. As things stand, predictions are that if things continue like this, Africa may not reach the 70% vaccination coverage target until August 2024. Just 6 countries have hit the year-end target of fully vaccinating 40% of their citizens, with only 20 managing to achieve a 10% coverage. I cannot stress strongly enough that vaccination is our best defense against the COVID-19 pandemic. We're at a pivotal moment, and complacency is our enemy. Africa is seeing more consistent delivery of vaccine doses, and we can still save many lives if we urgently accelerate the pace of vaccination. In real terms, if African countries get the doses and support necessary to vaccinate 70% of their populations, as is the case for many wealthy countries, we could avert tens of thousands of deaths from COVID-19 in 2021. I'd like to stress that these are not just numbers. They reflect the loss of mothers, fathers, sisters, brothers, children, colleagues, and neighbors whose deaths cause untold suffering for those they leave behind. And importantly, Africa's vaccine challenges are being compounded by Omicron-related travel bans. There is no strong scientific evidence to support the introduction of such restrictions to curb the spread of the virus. Yet they have devastating economic repercussions for the affected countries, which are struggling to reboot after 2 years of pandemic-induced negative impacts. Travel bans can lead to less money for food, medicine, education, and a host of services that keep people healthy, consequently jeopardizing the welfare of millions of Africans. They can also affect the supplies of critical items for health and other development areas. Globally, there are now more than 22,700 cases of Omicron reported in 59 countries, including 11 countries in Africa, which account for about 1/3 of the cases. However, Africa's share is steadily dropping, and South Africa can no longer lead the world in Omicron cases. As such, I'd like to appeal to countries to urgently reconsider the recently introduced travel bans. This is a time to instead show solidarity with your neighbors and to act in the interests of the global good. Going forward into 2022, WHO's COVID-19 strategy continues to focus on boosting vaccine coverage. It will also concentrate on increasing surveillance to up case detection and to track new variants of concern. Of course, the public health measures of prevention, wearing masks, physical distancing, and hygiene are also vitally important. There's a lot more hard work ahead before we can bring this pandemic under control in Africa and the world. I'd like to take this opportunity to acknowledge the tremendous efforts of WHO colleagues, our global and regional partners, African leaders and governments, ministries of health, our health workforce, and local communities. I'd also like to thank members of the media. You've worked so hard along us in 2021, helping to disseminate accurate information to your audiences around the world. So welcome again to this press conference, and I look forward very much to today's discussions.
Thank you, Dr. Moeti. Professor Flavia Sebungobe, please, could you tell us about the trends of COVID-19 in South Africa and the outlook for 2022, particularly with regards to Omicron?
Thank you very much, Collins. And I do first want to greet Dr. Moeti and also all the colleagues who are at this webinar, and just to also say all protocol observed. In terms of the trends in South Africa, of course, COVID-19 was introduced in South Africa in the early 2020, and we had our peak of cases during the week of the 5th to the 11th of July. Of course, to date, as Dr. Moeti has just said, we have 13,992 cases, which takes us cumulatively to over 3 million cases. And we have 174,340 active new cases. And the positivity rate, which is the number of tests done that have a positive result, are at 31%. And of course, as Dr. Moeti said, we have, as of 13 December, 11 new deaths, which take us to a cumulative total count of deaths of 90,148. I must stress and say that many of the new cases are in our province of Gauteng, followed by KwaZulu-Natal. And what is interesting, colleagues, is the seroprevalence, which I do want to chat about, which is the prevalence of individuals in a population who have antibodies to an infectious agent. After our second wave, 60% we had 60% seroprevalence, and this data came from our National Blood Service together with other studies. And our modeling colleagues estimate that we had 70% seroprevalence after the third wave, and an unpublished study, which is going to be published in the coming weeks, that has been done in the Gauteng province, estimates the seroprevalence to be about 80% in adults after the third wave. I do have to mention also, in terms of the vaccination coverage, as of 13 December, 40% of South Africans have received their vaccination dose and 25% are fully vaccinated. We are battling in terms of whether you call it hesitancy or indifference, but there is a concern in terms of the uptake of the vaccine. And so in essence, when we come to the findings on Omicron, if we take the 4 epidemiological periods from 13 November to 4th of December, we had an exponential rise in COVID-19 cases, and we certainly are in the 4th wave. And for instance, from the 1st of December, I can say that this is when the indication was that we entered the fourth wave, and we've again had a week on week increase in the number of cases, which have been higher than before. And as I said, the test positivity rate within these 4 periods started from 1.4% all the way up to 31%. And if you look at the Gauteng data, it's actually even higher than 31 to 33.9%. And as Dr. Moeti said, we've seen some interesting trends in terms of hospitalization and excess deaths, which have not been so high. And also we have seen that we have severe or less severe illnesses. And among those who are admitted in our hospitals, they have a lower requirement of oxygen, lower ventilation, and we certainly are not seeing this high number of ICU or high care, which really just shows us in these early indications that indeed the illness may be less severe. Early on in the fourth wave, we did see, especially among the children who are less than 5 years, having an increase in terms of admission. But now, currently, we are seeing it, the trend turning towards adults. And so all our admissions are mostly in unvaccinated individuals. And again, a case in point, as Dr. Moeti was saying, for vaccine access and solidarity across the globe to ensure that the Africa region does get access to vaccines. I must also add that in terms of the admissions have a shorter duration, or what we would call length of stay, because previously we, on average, the admission or length of stay was averaging about 9 days. But right now, in children, it's about 3 to 4 days. And in adults, it's between 4 to 5 days. And again, an indication of perhaps less severe disease. And this could be perhaps prior immunity from a natural infection, as I talked about the seroprevalence, and perhaps even vaccination, or maybe even lower virulence, maybe from the Omicron variant. But again, these are very early studies, and it's really postulation of what could be happening. And in terms of the COVID-19 outlook, Collins, for 2022, I think the first one has got to be global solidarity for vaccine access. I think, just in terms of echoing Dr. Moeti's words, we will never get out of this if we don't work together as one world. And I think what we have seen in the previous weeks of travel bans and isolation is something that I think will be very difficult going forward. And so I think global solidarity, particularly for vaccine access, is very important. One of the other things, of course, for Africa region is about strengthening the community-based case management in terms of developing as well clinical guidelines for the treatment of COVID-19, particularly in primary healthcare settings, because we have seen, particularly in our previous waves, that infections and deaths are happening very much at the primary healthcare setting. As the chair of the African Advisory Council on Research and Development, I cannot stress the support of the work of our scientists. I mean, we have seen exceptional work coming out from South African scientists, but there are a number of scientists across the region who've done exceptional work. And I think that the support of the surveillance work and many other, research work that's been done to combat COVID-19 from the Africa region needs to be supported, and our scientists certainly need to be supported. And lastly, I want to again echo the issues around non-pharmaceutical interventions, which still remain important: physical distance, avoiding gatherings, making sure people wear masks, and ensuring good hand hygiene. And because I am on this platform, and Dr. Moeti will not be able to say this about herself, I do want to commend the effort and work of Dr. Moeti together with the colleagues in WHO Afro, who have supported all our countries in ensuring that we work together. And I do want to echo the support and the thanks in terms of the media and all other stakeholders, the scientists, the frontline workers, the community workers, and each and every single person, including the grandmother in the village who may not be known by anybody, who's taking care of the family and ensuring that they are safe during this period. Thank you. Back to you, Colin.
Thank you, Professor Flavia Senkubuge. Now that we have heard from all our panelists, it's your turn to ask your questions. To do this, use the Q&A function on your Zoom application. Please remember to provide your name and the name also of the news outlet that you represent. Just to let you know, we also have on hand Dr. Fiona Atuhebwe, who is the new Vaccine Introduction Officer of WHO. We have Dr. Tieno Balde, who is the Incident Manager for the COVID-19 Emergency Response in Africa, and also Dr. Nixie Humede Moelexi, who is a Regional Virologist. Now, we've got a question from CGTN. And this question goes to, I will invite Dr. Moeti and Dr. Fiona Atuhebwe to respond to that. The question goes is, we are seeing the new Omicron variant spread so fast in some parts of Europe, despite the majority of their population having been vaccinated. We know Africa has been behind on that front. To what degree is Africa being threatened by the new variant? I will invite Dr. Moeti and Fiona to respond to this question.
Yes, thank you for that question. As we said, we have 11 countries that have identified that the Omicron variant is present in these countries, including not only just in Southern Africa, it's been detected, for example, in Nigeria as well. And so, of course, we recognize that African countries are at risk of having the variant emerge, as has happened in European countries, and it is spreading in countries around the world. I think a couple of things. Of course, we initially saw, due to the work done by scientists in South Africa and Botswana and the immediate reporting that they did of the presence of the variant, this variant seemingly emerging in Southern Africa. There are questions about it having been detected in samples that were taken in some other countries in Europe earlier, and therefore the fundamental question, where is it emerging? I think we need to think that the entire world is vulnerable to the emergence of a new variant, but we need to put the risk in perspective, as has been expressed by Professor Flavia and myself, based on the evidence that we are seeing. At the end of the day, the reaction to the emergence of a new variant needs to be linked to what we are starting to observe in terms of the risk that it presents to lives, about overwhelming health systems in countries, and the disruptions that it will make in economies in countries. As Prof. Flavia said, the evidence is a bit early, but we are somewhat becoming reassured that this seems to be mainly causing mild illness. So indeed, Africa is vulnerable. Many people in Africa have not been vaccinated. The virus is spreading very fast, including in places where people have been vaccinated. It is causing relatively mild illness, particularly among those who are vaccinated.
Thank you, Dr. Moeti. Dr. Fiona Atuhebwe, would you like to weigh in on that?
Thank you very much, Collins. I think Dr. Moeti has said it all. But we also need to note that for Omicron, we have been testing more in certain populations that have higher rates of vaccination. For example, international travelers who most countries are requesting to be vaccinated, and these are being tested both before departure and in many countries on arrival. So if we test more vaccinated people will definitely turn out positive. But also studies are ongoing to see if the Omicron variant has an impact on the vaccine effectiveness. And it's important that we are patient. It will take another week or so before we have clear evidence on the vaccine's performance against the variant.
Thank you, Fiona. The second question from CGTN is that we are approaching the end of 2021, and as a continent, we have vaccination targets. How many countries have met them, and what are the projections for this year?
Well, that is the World Health Organization Africa briefing on COVID-19.